Good afternoon. This is Holly Schroeder with the Santa Cruz Valley Economic Development Corporation. I want to thank you guys for taking time this afternoon as people are coming online. We are just going to get started here because we do have a lot of information available to all of you, for all of you today. And I am looking here and seeing additional attendees coming online as I'm speaking. The numbers are going up, but I'm going to go ahead and get started with some introductory remarks. For those of you that don't know me, I'm President and CEO of Santa Cruz Valley Economic Development Corporation. I think most of you have had some level of introduction to the EDC, so I'm not going to go into a lot of detail about that. You certainly, we want you to know about us, and we are trying to do everything we can to be a resource to you during these tumultuous times. This is sort of our first endeavor in creating what we're calling our large employer roundtable. We want to engage with the largest employers in the Santa Cruz Valley and start, just being, increasing our presence, increasing our influence of the business community in the Santa Cruz Valley. We were going to launch that this fall. Given the circumstances, we knew how important it was to provide very specific information to you now, which is why we organized this webinar. Just so you have an idea of who you are in fellow contact with today, we have dozens of companies that have signed on today, collectively representing over 14,000 employees here in the Santa Cruz Valley. That's somewhere in the neighborhood of 18% of all employees here in the Santa Cruz Valley that you are leading. And so how you are able to navigate this crisis and we hope keep people employed and safe is very critical. And so we again appreciate your attention here. Let me just we'll quickly give you an overview of what the plan is today. We have sort of three segments. The first is the medical and health segments, and I'm very pleased that we have medical professionals and the CEO of Henry Mayo Newhall Hospital, which, as you know, is the hospital in the region and still a community hospital. We will have a presentation from them describing our readiness and what's happening here on the ground in the Santa Cruz Valley. And then we will have a discussion from Mark Emmer, who's going to talk a little bit about, what this all means for business continuity and your management readiness. And then we'll have a discussion from Brian Koegle, who will talk about some of the legal frameworks for the various decisions, especially personnel-related decisions that you are going to be making. A couple of things about the system today that we are on. Your questions will be coming in by text. If you look at, you should have a sidebar column that is on your screen. You can expand and contract that sidebar by hitting the orange arrow button. That will shrink the screen or bring it back. Within there is a questions panel. Those questions will come in to me via text, and I can put them forth to whichever speaker. So please use those questions amply. We want to make sure that we give you all the information that you are seeking today. We do plan, those will come in. I will share those questions anonymously. I know that many of you are dealing with very difficult employment and business decisions. And we do plan to rebroadcast this as our intention, but please come in with those questions so that we can put them forth to the experts that we have assembled for you today. And with that, I'm going to turn the speaker over to Roger Seaver, who is CEO of Henry Mayo Hospital. He also happens to be the co-chair of Santa Cruz Valley Economic Development Corporation. And so, Roger, I turn it over to you.
Thank you, Holly, and it's my pleasure to spend a moment here just to introduce some of the medical leadership that really takes the lead in this particular challenge to our community and to our healthcare system. First of all, you will know, probably, many of you do know, our Chief of Emergency Medicine, Dr. Bud Lawrence. Dr. Lawrence is on the front lines every day in our community with his team and staff in our emergency room. In the case of this issue, we move outside of the emergency room to streamline and allow early access and decision-making before anyone enters our hospital with any concerns on the virus. So in a moment, Dr. Lawrence will tell you about our readiness and our front door in the emergency room, where we see on a regular basis 75,000 people a year come through our emergency room. Second in introductions here is Dr. Kingman Ho, probably less known by many of you, but he serves as our Chief Medical Officer in the administrative suite, a key executive within our hospital and our growing healthcare system. So Dr. Ho historically has many years of practice in the Seattle area, led an affiliate of the University of Washington Hospital and the organization of their hospitalist program, et cetera, prior to him accepting our offer to be our Chief Medical Officer, I think about 3 years ago. Is that right, Kingman?
A little over 3 years and 6 months ago.
Yeah, he's counting every month of this great experience in the Santa Cruz Valley. So I'll get off there. This is really all about health and the virus and all of the directives that we're trying to not only meet or exceed in the Santa Cruz Valley. So with that, Dr. Lawrence.
Good afternoon, everybody. It's an honor and a pleasure to be able to address you today. Very important people in our community, and it's great that we're able to get the word out about what Henry Mayo is doing, what we've done, and perhaps what to expect. So first off, to frame this, I want to just make it very clear, we are very ready. We are much more prepared, I would say, than our like and kind hospitals in the surrounding areas, and I think you should have great confidence in that. What we'll talk about, what I'll start with, I think I'll be more helpful probably with the question and answer side, but I think it's important for everyone to understand what our front-facing emergency department care is looking like as we sort of transition into this COVID-19 pandemic. First, I should say it is not a hoax, and also, conversely, the sky is not falling. It is definitely somewhere in the middle. The question is, where will it go from here? And we're not entirely sure. It's continuously evolving. Our ER has taken great steps to address this. The first thing that I would say is that we've moved our triage to what's called an external triage. So any patient that arrives to the ER for any reason that is not by paramedic transport will be met outside the emergency department, and they will be screened for fever and or respiratory illness. And if those patients screen positive for that, they enter into another set of questions where we find out about the possibility or the likelihood for COVID-19 infection or disease. So, and if they do fit the screening criteria for COVID-19, they're taken through the outside of the emergency department to a special entrance that we have where they're placed in a solitary room all by themselves where we can care for them appropriately. And from that point on, they would receive their care in a single or private room. If the patient is otherwise not sick in the sense that they don't do their test, those patients actually, we are leaving them in their car, and we have something called a drive-through COVID testing center. So many patients actually never get out of their car. They drive to the ER, stay in their car, they drive through the testing center. When they meet criteria, we send their tests, and they are on their way. They receive all their discharge paperwork, all their education in the vehicle. They're seen by the physician, obviously, in their vehicle. So that's something that we've been doing for almost a week now, and as of today, I believe, is the recommendation that all hospitals move to this sort of a model. We've been working on this for many weeks now and have been prepared for this eventuality. We also notably have a medical trailer outside. Some hospitals have tents. We do have tents that we have set up as well, but we also have a medical trailer fully furnished with oxygen and Wi-Fi, computers, all these things, so we can help take care of patients as well, should the need arise. We currently aren't at a volume where we are utilizing tents or the trailer, but we have them on standby, ready to fire up at a moment's notice. In terms of sick patients coming to the ER, perhaps via paramedic transport, we have all the personal protection equipment required for our staff. We have methods in place, strategies in place for us to address these patients and care for them whatever they may need. So I don't want to go into too much detail. I think it's probably not helpful for you in the sense that it's too granular. But again, I think I'll be most helpful answering questions. I'll pass it off to Kingman Ho, Dr. Ho, for some further information about the hospital itself.
Thank you, Dr. So with our COVID-19 situation, which is rapidly evolving and certainly affects us all, not only in the hospital, but also in the community, the strategy overarching really is about containment and mitigating further exposure and further transmission. To that end, this is exactly the philosophy we have adopted at this hospital facility. So Dr. Lawrence very eloquently described the concept of external triage, where we basically assess patients and determine whether or not they have a high likelihood of COVID-19 or not, and treat them, screen them as necessary, and release them back for home quarantine, and only bring in those patients into our facility that are necessary for acute medical intervention. We have isolation areas not only within the emergency room, but we have developed a concept of developing dedicated medical units or hot zones where we can cohort both suspected COVID-19 patients and eventually confirmed COVID-19 patients. We want to make sure that we have the proper isolation for these individuals so that they do not potentially spread to other patients nor to other personnel. In this process, this helps contain the situation further. In support of this further, we have dedicated personnel that have been fully trained on the proper personal protective equipment, as well as the procedures to maintain isolation precautions. And we are actively developing protocols as well as a dedicated clinical team, including physician specialists in infectious disease, critical care, pulmonary medicine, as well as internal medicine and others, to be a dedicated resource to be able to efficiently, effectively standardize the care of these patients in a highly proactive fashion. To the extent that we also are maintaining containment strategy and providing safety for our patients, our employees, and medical staff, we have also instituted a policy and process of screening all our visitors to ensure that they do not have any active symptoms or signs of potential COVID-19 infection. Although screening has been demonstrated to be effective, we are looking at additional measures to ensure that we can accurately detect and diagnose early so that we don't necessarily expose our people to potential further disease.
I think just to add, our other offices where we provide services, we're doing the same screening. So any access to the Henry Mayo system, if you will, gets the same opportunity to be screened before. And then by necessity, we have very limited visiting capability, one per patient with a few exceptions, of course, depending on the healthcare and family needs.
Yeah. So we've implemented this organization-wide. As developments occur through the COVID-19 progression, we will be instituting further measures as deemed necessary. Right now, we've also implemented a process to ensure that we provide the best outcome possible, and to those patients that are deemed truly elective coming into our organization for non-urgent, non-emergent procedures, we have chosen to defer some of those procedures in the best interest and safety of those patients.
And I think that, we have a command center meeting every day, and I think something that's applicable to many people on this call is that this is continually evolving. And I think it's very important to have a structure in place where you can be agile and you can adapt, because whatever you're doing today may not be what you're doing tomorrow. And whatever you're doing tomorrow might not be what you need to be doing next week. So very important to get a plan in place where you are now, but be aggressive about updating that plan as you go.
Right. So not only are we actively screening right now, but we are also testing suspected individuals that have symptoms and signs consistent with CDC, Centers of Disease Control guidelines. We recognize that ideally it will be beneficial to have all individuals screened and tested to know immediately if they are infected with the coronavirus. However, currently, given our national resources of limited tests, there are only certain test kits that are available and very limited resources. So we are advocating and adherence to regulatory and national guidelines for administering these tests only for suspected individuals per guideline. The second piece is that with the limited resources right now, the test times in terms of resulting is anywhere from 48 hours to 4 to 5 days, or sometimes even longer depending on the area. This does create a fair amount of consternation and concern, not only for the individuals who are being screened and tested, but also for other members that come into contact with these individuals, as well as caregivers. The reality is that the best treatment for these patients or who may or may not have been exposed to the coronavirus, assuming that they are not in distress, really is basic symptomatic care. Unfortunately, right now, today, there has been no defined vaccine nor defined medical treatment to intervene with the course of the COVID-19 disease. So symptomatic supportive measures in a self-contained area, oftentimes that area is home, is usually the best course of action.
Just to step back 1 second about the testing, I think people on this call, you have a great outreach. You have a lot of covered lives underneath you. It's important to set proper expectations. If you feel that your business, you just want to send everyone to the emergency room for testing, they're only going to be tested. We have to be clear about this. You can really only test patients who fit CDC guidelines or people who fit CDC guidelines. That will change. Again, everything is evolving. I think there will be many more commercially available testing options in the near future and in the near term. But for current state, please, for your staff and your administration, understand that we need to have the right expectation in the community that if you show up here demanding a test, unfortunately, it can't be provided to you unless you meet the CDC criteria.
Doctor, let me break in here for a moment just with a couple of questions that have come in and relates perhaps to this. Can you forecast forward a couple of weeks? We're obviously hearing that as more testing comes available, we will see, we'll see more positive cases. What how is the hospital prepared in terms of surge capacity, both in the screening ER as well as in facility capacity? Can you speak to that?
So, Holly, we have actually been working diligently for the last 2 weeks to be able to meet the demands of the community. We have, although currently we resource constraints in terms of laboratory testing, we have actually been able to resource effectively a resource pool of nurses as well as physicians to be able to treat and screen patients effectively in the emergency room. We have already realigned 2 medical units in our facility to manage the coronavirus exposed potential patients as well as potential COVID-19 identified patients. These 2 units currently have a capacity in total of some 45 beds. We have already identified the clinical teams to be able to support these individuals as well. At this juncture in time, we have the medical supplies and equipment, but we do need to be diligent in terms of ensuring that the right supplies go to the right individuals at this juncture in time. We anticipate that the course of the coronavirus will be no less than 3 to 4 months in the community at this juncture in time, and we anticipate being able to serve those needs. We are also preparing to expand beyond those 45 bed capacity as needed.
And another point about more people testing positively in the next couple of weeks. If you test more people, you're going to see more positives. I mean, let's be clear about where the situation is currently. The virus is in our community, but that said, the overwhelming majority of people who contract COVID-19 are going to have a very, very mild course of illness. To Dr. Ho's point, best option oftentimes is to stay home, fluids, rest, and Tylenol and Motrin. So yes, as testing capacity increases, you will see greater positive results. What that means is more people will know that they have this infection, and there'll be more quarantining.
As a follow-up to that, you've indicated obviously that we have capacity. Can you speak to what the regional network looks like? Do we think there will be folks from outside the Santa Clarita Valley who will seek testing or treatment here?
We don't have an expectation that people will be sent here from outside. We do have an expectation that the greater healthcare system, which is very connected, will bring on capacity that may exist in other areas that, if needed, hospitals that have no capacity will be able to refer here in Southern California. Now, that's still a work in process, but our countywide system in LA County is one of the best organized. We're electronic on all capacity issues. There's constant surveying going on as it relates to capability. And as you get more and more impacted, that becomes a very significant part of the resources. Where are the beds? Where's the capability, and who can get there? And of course, if we end up having capacity and others don't, that network could supply us with some influx. But it's always the goal to take care of the local community in the local community, particularly in this type of situation. So we think our own capacity, not knowing the numbers yet, will ebb and flow within what we can stay ready for physically and or through emergency type development of supplemental beds here on campus. But that all goes in the day-to-day management and the demand cycle.
And I would add that you all have heard the term now, flattening of the curve, I'm sure. The closing of schools, trying to do social distancing, all these things are flattening the curve, which increases our likelihood, every hospital in the area's likelihood of sustaining a heavy influx of patients. It's trying to stay away from the Italy experience. and trying to make sure that every hospital can handle surges of patients that are well within their capabilities. And I'm optimistically confident that steps that have been taken should lead us down that path of flattening the curve.
And can you also review a little bit about like when our employers here, what they should be communicating in terms of medical detection, you know, when people are sick, what they're looking for literally on the ground, and when should they, you know, where to send folks and how do they make sure that they don't send folks unnecessarily? Can you just review that one more time?
Sure. This is Bud Lawrence. So essentially what you're looking for, common symptoms are, everyone knows these already: fever, dry cough, and fatigue. And and certainly contact with anyone who's positive. If you're having concerns about this, you should be referring your employees to contact their primary physician. Obviously not my area of expertise, but if it's a work-related thing, that would be different, I suppose. But primary care providers are your first stop. If for some reason, and speaking honestly, many primary care providers are unable to test patients at this time because there is such a shortage of test kits, and that availability is hampering their efforts to test patients as outpatients. The next step would be, we have a phone number at the hospital. I believe the phone number is 661-200-2619, which is CO19 for COVID-19. And that is a phone line, certainly during the daytime hours, is manned by a human and is meant to answer questions for patients that may occur. And certainly, as always, Henry Mayo is your safety net here in this community, and should there be any issues, you can always come to the emergency department, and we'd be happy to screen those patients. But truly, the first stop would be primary care physician.
Dr. Lawrence, just getting clarification on the, I believe there was a quick mention, I'm not sure which doctor mentioned it, to Motrin. My understanding is WHO is making some changes. I'm not sure if that was Motrin or ibuprofen. Do you guys have the latest on that we can provide? And we will certainly make sure we get that phone number posted and out to everyone.
I'm not up to date with that is something that I think changed today. I've been running around incessantly here at the hospital taking care of things, and I usually am able to review those things in the afternoon. So I have not had a moment to look at that, but I did see something fly by that perhaps Motrin is not recommended, but I cannot independently verify that.
So the WHO has recommended as of today that people suffering COVID-19 avoid taking ibuprofen, as French officials have warned that anti-inflammatory drugs, so Motrin, Advil, ibuprofen, they're all one and the same type of medications, could worsen the effects of the virus.
Again, though, all these recommendations, there's just many things we don't know, and so something like this comes down the pipe, and I think it's a good idea to look at it and perhaps avoid Motrin until we have more information. But there are many changes that this continuously evolves.
Right. So the recommendation at this point in time to kind of treat the fever, temperature associated with the viral illness, as well as the various aches and pains, the myalgias, would be to use Tylenol or acetaminophen, which is not an anti-inflammatory.
Okay.
I'll put that on the website.
Yeah.
And I've posted responses with the phone number, and you'll see it to all attendees. You'll see at the end of our site. We at the EDC have a resource page. We will make sure that phone number is prominently displayed there and updated as well. Has links to the Henry Mayo page and others. And obviously, this is a rapidly evolving situation, so we certainly want you to be, abreast of these changing recommendations. I'm going to pause a moment and ask people to send in a last round of questions, if there are any, before we move on to our next section. But Roger, I'll have you also check with the doctors there to see if there's any other points in terms that they wanted to make that we need to circle back to.
No, I think they have some other appointments coming up, so if there's any questions left for the doctors, be happy to field those, I'm sure.
Great. I want to thank both of you, Dr. Lawrence and Dr. Ho, for your time and expertise this afternoon, and certainly for the preparedness that Henry Mayo has put in, and your continued staff diligence on that, on everything here. With that, I'm going to move on to sort of our next speaker, which is Mark Emmer. Mark is a expert in strategic planning and strategy, and he's spoken with hundreds of keynotes and CEOs across the country. But we are fortunate that he is a local Santa Clarita Valley resident, and he's been a real support to the EDC and formation of this large employer roundtable, and to many of the companies here. With that, I'm going to go, and Mark, I'm going to change the presenter to you, and let you go from here. Thank you very much.
All right. Good afternoon, everyone. Can you see my screen, Holly?
Yes.
Okay, awesome. So first, I'd like to thank Dr. Lawrence and Dr. Ho. Your words were actually very encouraging, I thought. So never in the course of history has the old adage been more true. We need to hope for the best and plan for the worst. These events, obviously, over the last few weeks are completely unprecedented, and our ability to manage change is being tested at the moment. So I'd like to just offer some high-level insight on preparedness in general, and also some specifics that relate to this particular crisis. So I think there's three kind of levels of threat from a strategic standpoint. You know, our financial systems could melt down, and there could be a recession equal to or worse than a liquidity crisis. That would be kind of the level one threat. The level two threat, we could have a prolonged financial contraction, which kind of reshuffles the deck in a lot of your industries, and could create kind of a prolonged hangover for the global economy. And then the third level threat would be something more like we have 6 to 8 weeks of a healthcare crisis followed by a tepid recovery. And maybe during that time, we don't manage change as well, and we damage our reputation with our customers or employees. But I think to suggest that we're just going to return to the way things were is pretty improbable at this point. So our clients have already attacked on supply chain, and they've taken steps to make sure their employees are out of harm's way from a physical standpoint, and they're trying to figure out what's next. So kind of what I'm going to present are like phase two kind of mitigating strategies, and I'm going to cover a lot of material very quickly so we can get to Brian. But the email that Holly will send out after the webinar will include my deck if you'd like to look at it again. And kind of the last caveat, and this is kind of an unusual thing for me to say, but I'm actually really hoping that you've already done everything that I'm going to present to you, but we can just never be vigilant enough. So in terms of dealing with these black swan events, those who prepare for things that they can control are in a better position to react to uncertainty. So these are best practices that you could employ in a natural disaster, a health emergency, a utility failure, a cyber attack, or any other market shock or kind of unforeseen event. And we'll go through some blocking and tackling as far as business continuity planning, but business continuity is a process by which we assess risk and create a set of safeguards. People will use terms like business continuity, disaster recovery, contingency planning interchangeably. So I'm going to try to make some distinctions on these things. But I think the very first thing that you have to do from a kind of a governance standpoint is to reorient your senior management team. So until we know what the depth of the problem is, we're kind of on wartime footing, and I would suggest that you just reprioritize everything and kind of weigh the risks that you need to mitigate today, and the fact that the actions that you could be taking could actually bring some kind of long-term financial harm to your organization. So you've probably already identified that team that would be in the war room and put together a written plan which kind of identifies the risks to the business. But you might organize your plan into kind of 3 phases. So that would be things that are, those are things that are kind of first phase, or things that are more preventative, or things that are things you might kind of fix after the fact. So preventative, response, or recovery. As it relates specifically to the coronavirus, we still don't know what all the unintended consequences are. There could be a shock within the U.S. banking system. What if the U.S. Mail or Amazon ceased operations? What if you couldn't communicate with your team every day through traditional methods such as email? So I think the most important thing is how will you manage your documentation, information, and data. So 2 points of emphasis in an extreme crisis. You probably need to have some kind of messaging system, something like simplified alerts, so that you can reach all of your employees in a seamless way. And also, you should be running simulations to make sure everything that's in your continuity plan is tested and will be effective. I think another consideration is that we are currently in the midst of the largest work-from-home experiment in the history of our economy. And as someone who's had virtual employees for 17 years, I'm a little concerned that we're doing this overnight. So just because your employees may now have permission to work from home, that doesn't mean that they're prepared to do so. So the employers who've been really progressive over the last few years have implemented collaboration tools to promote virtual work. And so this would be the time to make sure that your procedures are in place so that there's no real drop in your productivity. So as your teams get settled and potentially there's a slowdown in your business, you might revisit some of these collaboration technologies, such as using threads like Slack or project management systems such as Trello, Asana, or Monday that really ensure the flow of information throughout your organization. And if you're a Microsoft shop and you use 365, Teams has most of that functionality, and that's usually kind of bundled right into your suite. And then the other thing is, overnight, you better get good at managing virtual meetings. And if you've seen any of the kind of parodies on the internet, you know that they don't always go so well. So a few things I just want to mention about running webinars and virtual meetings and the like. Make sure you have a proctor for every important meeting to ensure that the technology is running smoothly. Train your people how to use these technologies. Make sure that the participants have a help desk number, and make sure that your IT teams have the capabilities that they need to manage this workload. Most of them should have a ticketing system. You might even consider outsourcing some of their work. I'd also invite you to think about contingency planning. You really need to stress test your business from a financial point of view and consider what contingencies you might put in place. So I really think you need to brace for impact, right? There's a reason why the U.S. government is flooding our economy with $1 trillion in liquidity. GDP is about $20 trillion. So I'm not confident that a $1 trillion infusion is going to save us. So we really need to be planning for these macro events. This would be the example of a contingency plan for a company losing 25% of its revenue. So, in your war room, you should be thinking about, well, who would be responsible for what should your organization face an impact such as this. So a few other considerations for contingency planning. You should be able to model your revenue based on your key performance indicators. The companies who are best in class are able to kind of forecast their revenue months in advance based on the numbers they have today, whether that be sales calls, proposals, conversion rates, return on marketing activities, backlog, those types of things. So your KPIs are of heightened importance at the moment. So those who have that level of structure are going to fare far better in these kind of moments of uncertainty. So it's time to stress test your P&L, your balance sheet, your cash flow statement, and certainly your bank covenants to meet all these realities. And I don't have to tell you that right now cash is king. And then finally, Brian's going to go into this, but manage this massive human capital risk and the cost that you'll have associated with these new realities. So here are some things that you can do now. Make sure that your sales team is documenting all their activities in your CRM. One of the unforeseen consequences in this environment is this is actually a time they can reach customers on the phone. So while they may have been in the field in the past, this would be the time actually for them to stay in front of their customers. And then while business is slow for you, there may be a few things that you may not typically focus on, but you could be focused on. So cross-training is particularly important, especially for any single points of failure. You need to make sure you have kind of redundancies throughout your business. You could be doing things like performance reviews and focusing on learning plans and training opportunities and so on. And then there might be things that you can do that are like novel new ways to serve your customers. I know in our firm, we're going to start a virtual strategic planning service just to attract new customers that we don't already have. So there may be new opportunities that you might need to think about, maybe forms of dynamic pricing, for example, so that you can adjust with the needs of your customers. But I just want to reiterate what I said earlier. From 20,000 feet, the single most important thing is our level of communication. We're all kind of scrambling right now. Our businesses are under stress, but our employees are also under enormous stress. They're fearful of their jobs and our furloughs, paying their mortgages. And it's just critical as leaders that we manage our own emotions. We are clearly communicating our intentions to them and communicating that we have their back in terms of their physical safety and their emotional welfare. So start with your senior management team, cascade from there. I personally think we have some dark times ahead of us in terms of the economy, and this recovery will take a while, but this is also the United States of America. We have resources unlike any other country in the world, and it's just critical that we lead and inspire confidence with our teams. So with that, I will kick it back to Holly so she can introduce Brian.
Great, thank you, Mark. And we are, for everyone who is sending questions, I'm just as I'm changing this, as we do this, please bring the questions in. There has been a couple of additional medical ones. We will circle back to those, and we'll take questions from Mark and Brian and circle back to those at the end. So know that those have been received, and we'll do our best to get those answered. And please just keep coming in through that question panel. If you have your hand raised, please submit a question through that. I now would like to hand it over to Brian Koegle. One more reminder, when my staff is reminding me, make sure you're hitting the send button. There's like a send button rather than just a hard return in order to make sure your questions are coming through. So with that, I'm going to turn it over to Brian Koegle, who is a partner at Poole, Shaffery Koegle LLP. I stand corrected on that. Brian is a partner and an expert in employment law and everything associated with California employment law. And so with that, Brian, I am going to set up here to run your PowerPoint because I'm going to need to do that. So bear with me one moment, folks, while I get that set. And there. I believe everybody can see that. And with that, Brian, I will, Brian, can you go ahead and begin speaking?
Absolutely, I will. Thank you, Holly. Thank you, Mark, by the way. I appreciate you ending on such a positive note because I'm going to bring it back down to ground zero here. Go ahead and put it on that first slide for me, Holly, if you would. So, ladies and gentlemen, I have breaking news for you. In the last 90 minutes, I can confirm with you now that we have the long-awaited federal relief bill that was sitting in the House from last Friday night. It is known as House Resolution 6201. It has now been passed by the Senate with modifications, with revisions to it being made. Up to date, as of this moment, the President has indicated he will sign the bill. We anticipate that will be happening either late tonight or early tomorrow. Here's what you need to know as HR 6201 comes into play. First and foremost, this is going to carry a mandatory paid sick leave period for all employers with 500 or fewer employees. That means if you have over 500, this bill does not apply to you, but most of you on this call, it will apply because you have 500 or fewer employees. As part of 6201, we are required to provide a full 2-week paid sick leave as the employer to any individual employee who has tested positive for the COVID-19 virus or who has been placed on a self-quarantine by a medical professional. Beyond the 2 weeks of paid sick leave, and that is at 100% of their paid sick, or their regular pay, pardon me, there is an additional provision that was just added by the Senate today. It is an additional 10 weeks of leave at 2/3 of the employee's regular pay. That is to care for themselves, an immediate family member who is ill, or for a parent whose child is now without daycare or school due to school closures. This is a major change in what had been originally proposed in HR 6201. It could provide up to 12 weeks, the 2 weeks of paid leave, and then the 10 weeks of additional leave at 2/3 of the regular pay that an employer may be required to provide for their employees. While it does expand worker protections, it does not specifically give us any clarity on how we're getting the money to the business owners to pay for this. The original bill, 6201, indicated that they would be passed along to the businesses through tax credits. However, the President this morning, as part of his stimulus package, which will be presented through an executive order from what we believe at this point, indicated that he believes he's going to be able to get money to businesses faster through a direct payment. We do know that as part of the President's stimulus package, he is looking for $1.3 trillion of that money. $250 billion of it would trickle down to small business owners. Not entirely sure how this is going to work just yet, but that is the proposal that is coming forward from the President as of this morning. The other thing that the President did this morning was he initiated the rights under the Defense Production Act. This is actually the first time we have initiated the Defense Production Act in the United States since 1966. What this does is it allows the federal government to ramp up production. Usually it's of military-grade production, tanks, weapons, weaponry, and ammunition. However, in this case, the President indicated he wants to use the Defense Production Act to create production of goods in the medical equipment field, personal protective equipment, additional masks. So if for those of you businesses that are in this realm, there will be additional revenues coming from the federal government to expedite the Defense Production Act initiatives. And then, of course, yesterday we heard about the extension of the tax filing deadlines and obligations by employers. Talk to your CPAs about that one. I am not a tax attorney. Next slide, please.
Brian, before we go on to the next slide, if you can indulge, a couple of questions come in just on the applicability of what you just described, especially HR 6201. When you say 500 or fewer employees, is that per site or for a company as a whole? If a company is a division of a larger company, what can you share, if anything, on clarity about that applicability?
There is no definition of that yet. That is one of the regulations that will have to be clarified. But as it sits right now, it would appear to be company-wide, not location-wide, because there is a subdivision of by location where there are exemptions for what we'll call much smaller employers whom I don't believe we have on the phone today. Those would be folks with 50 or fewer employees nationwide.
Okay. And this is only related to the sick leave, especially only related to illnesses and I'll say emergency declarations related to COVID-19. So that is correct. The weeks and the 2/3 for 10 weeks, that is only related to this. It's not all sick.
That is correct. One of the Democratic senators this morning attempted to make this across the board such that it would move forward even beyond COVID-19. That amendment failed. The amendment that modified it to add the 10 weeks was done basically as a result of the school closures that have taken place since Friday when HR 6201 was passed through the House. So in these circumstances, it does apply only to those people who have been diagnosed with COVID-19, those who have been exposed to another individual and who have been placed on self-quarantine by a medical professional. This is not somebody who makes their own decision, and I'll talk about that in a little bit. But if they are self-quarantined by a medical professional, these leaves would apply to them as well.
And based on the assumption that the president does sign this potentially as soon as tomorrow, does this go into effect immediately?
Yes, it has immediate effect.
Okay, which I believe all of that parameter sets up your next slide.
All right. So next that we have to deal with is, what are we doing as employers? I am looking at this from the people who have called me in the panic over the course of the last 10 days. The specific issues that we are looking at in way of dealing with this from a small to mid-sized business level, and I consider small to mid-sized anything under 10,000 employees at this point, is we are looking at what we can do in way of reduction of hours in order to minimize costs. We are looking at work furloughs, leaves of absence, and layoffs. I'm going to spend just a few moments on each. First of all, in California, in order to conduct a reduction in hours, you must provide written notification to the employee of a change in status. Employers ask all the time, can we reduce hours and reduce the pay rate? The answer is yes, as long as you do not reduce the pay rate below the state minimum wage, which for all of you on this phone call today will be $13 an hour. That will not be an issue. You may reduce hours and wages in order to keep the business afloat. One thing I will flag for you is that in the event that you reduce an employee's hours worked by 25% or more, the employee will be eligible to receive supplemental unemployment insurance benefits through the EDD, Employment Development Department. Anything less than a 25% reduction, it is on a case-by-case basis for the EDD to decide. But at 25%, drop into category of protection. That means if you have a regular employee scheduled to work 40 hours a week and you drop him or her below 30 hours, they will meet that threshold and they will be eligible for subsidies through the state unemployment plan. Keep in mind that if you are doing a reduction in hours and you have exempt employees, meaning individuals who are exempt from the state overtime, meal, and rest period requirements, you may reduce their salary in whole day increments if you are basically shutting them down for a full entire day. However, be very careful, because remember, the presumption in California is if an employee performs any of their salaried exempt duties during the work week, they are generally entitled to their full salary. If as part of your cost savings measure, you're basically saying we're only going to work people Monday through Thursday and no one's working on Fridays, you may reduce that salary as long as the salary does not drop down below the minimum salary threshold of, at this time, $54,000 and $54,080. All right. The next step, if we're not talking about going through a reduction in hours and we're faced with basically shutting down our plant or our location for a week or 2 weeks, anything up to a 90-day period, we can go through a work furlough. A work furlough can be temporary on a week-by-week basis. This also requires a written notification to the employee. In the event that you are discharging them or releasing them of duties from working for an entire week, they would be entitled to receive unemployment insurance benefits during the time period that they are off work. The one thing that comes into play that many employers don't think about, when you furlough an employee for more than 1 week, the provisions of California Labor Code 201, 202, and 203 apply, and that means you must cash out any unused but accrued vacation or PTO at that time that you furlough them. If you do not furlough them, or if you do not pay that out, you're in violation and waiting time penalties will apply. The leaves of absence that are available under California law currently are being modified as we speak. Governor Newsom indicated last night that he wanted to expand the protections under the California Family Rights Act. But at this moment, as we sit here today, generally, cold and flu symptoms are not covered under any state or federal disability leave laws. But you need to be aware that if the modification comes into play that Governor Newsom has proposed, it would cover those. At this time, the CFRA only covers serious health conditions that may be exhibited by the employee that go above and beyond cold or flu symptoms. The one other thing I'll flag for a potential leave issue is that the Americans with Disabilities Act may also apply if the injuries or illness that arise from the COVID-19 virus limit a major life activity. Going outside, going grocery shopping, coming to work may possibly be a limit on a major life activity. Talk to counsel about how this applies in your business. I just want to take one quick sidebar before I move to the next slide. I just want to flag that if you do have employees who have come down with the virus, who have had a positive diagnosis, there are benefits that are available through the state of California that we are strongly encouraging employers to help their employees with. If they are in a limited short-term injury or illness certified by a physician, they would probably be eligible for state disability insurance, SDI, through the EDD, that's the Employment Development Department. In the event that they're not ill, but they need to take a leave from their work in order to care for a seriously ill family member, in addition to the federal bill, they would be eligible for supplements under PFL, Paid Family Leave. In the event that you reduce hours below 25%, if you go through a work furlough, or if you have to go through a layoff, the employee would be entitled to unemployment insurance benefits. And then finally, the one last thing to consider, depending on the type of industry that you're in, if the employee is subject to exposure to the COVID-19 virus in the workplace, there may be a workers' compensation liability exposure for the business in that situation. The one last point I want to lay out on layoffs here very quickly. Last night, Governor Newsom did give some relief to employers. The rule before has always been that if you are going to lay people off, if you have 75 or more employees, and you get rid of 50 or more people as part of a layoff, you're supposed to provide WARN notice. That is 60 days advance notice prior to going through the layoff. Well, needless to say, none of us can really wait 60 days before we go through a layoff. So the governor gave an immediate reprieve, and the new standard for notification to an employee for Cal WARN notice is, quote, as soon as practicable, unquote. Don't ask me what that means because I don't have any idea yet. The notices, though, that we provide to our employees of layoff as of yesterday now must say that they are eligible for unemployment insurance benefits in writing and provide them a link to the California Labor Commissioner's Office. I will provide that to Holly so she can put it up as part of the resource materials for the SCVEDC. All right, that handles that slide.
There's a bunch of questions, but we're going to do the last one, and then we'll come back to those questions.
That'll be great. Go ahead and move along. The last slide then is going to be talking about telecommuting and working from home arrangements. Why? Because everybody's asking about this. I've given you the good, the bad, and the ugly on this slide. The good, we have location flexibility. People get to work from home. They get to have more flexibility in their day, in their time, in their productivity. We also get to honor these social distancing requirements that have been pushed forward all the way from the top down, from the president down. 6 feet, you're not going to be around a coworker because you're going to be working from your own personal home. And then the third thing is employee morale. Folks won't have to be worried about coming into work and being exposed to the illness, and it will really boost the morale in that circumstance. The bad, the cost of technology or the use of personal devices. For many of us, sending somebody home, as Mark talked about, we're just not prepared for it. We were not ready for something so immediate. We don't have extra laptops. We don't have extra computer systems that are equipped to handle work from home situations. Additionally, if an employee uses his or her phone, tablet, laptop, uses his or her internet service from home or her telephone from their home phone number, these are all business use of personal equipment that must be reimbursed pursuant to California Labor Code Section 2802. So be careful. Another portion of the bad, we lose employer control. The day-to-day activities of what an employee is doing, their productivity, their effectiveness tends to go down. And then finally, confidentiality and privacy. Depending on your industry, sending clients or sending employees home with client information just simply isn't viable. You have secret or top secret clearances. You have productivity and privacy rights for each of your employees. These are all things that we have to take into consideration as we're talking about telecommuting or working from home. And then finally, the ugly. Where are the lawyers going to come in all of this? Wage and hour compliance. How do you make sure that people are clocking in and out, taking their prescribed meals and rest periods, not working unauthorized overtime because they're sitting on Facebook half the time as opposed to doing productive work? These are all things that we're giving up control over by allowing a work from home or telework consideration. Additionally, workplace safety and workers' compensation claims. You don't get to control the circumstances of their workplace. We don't know whether there are any dangerous or hazardous activities when someone is working from their home. We have forfeited that control, and it puts us as employers in a much different place than we would like to be. But as Mark said, this has now become our new normal. This is what we have to adapt to. We are a resilient people. Many of you on this phone are entrepreneurs for a reason. You had a vision, you had a dream, and we're going to be able to work through this together. I just want to make sure that everybody has some of the rules of the road so we're all operating in a safe environment and making the best decisions possible for our business as we grow. Thank you.
Thank you, Brian. A question about, a handful of questions have come in here. If a company shuts down sort of as a safety precaution, what are the rules of that in terms of vacation pay, sick pay, other provisions that might be applicable there?
Well, if it's a shutdown without a furlough, meaning that an employee is not being released from his or her employment obligations during that time period, an employee must be able to use his or her sick leave that is accrued or banked time, and the employer should give the opportunity for the employee to choose to elect to use any accrued but unused vacation, PTO, or personal time off. If the employee chooses not to take their personal time during this period, it can be unpaid time off, or it could, of course, be supplemented by the state, as I discussed earlier. The problem that we have, obviously, in shutting down for quote-unquote safety's sake is unless it is specifically directed by a government agency, the federal government, the state, a county, or a municipality, that business decision to close down is technically a change in employment status for the employee that requires the employer to provide notice of either a furlough, a reduction in hours, or a layoff.
Yeah, Brian, can we go back and clarify as it relates to the new House resolution? First up, if you are a smaller business under 50, does it apply, or are there extra provisions? And then can you also clarify the child care provisions about does the parent need to be diagnosed or quarantined for that 10-week family leave to kick in, or is it simply a child out of school for a sick parent or a not sick parent? You need to run through those again because there was a lot in there.
Of course, I understand, and I'm still dissecting it as I'm going, so bear with me. So first of all, for the employers with 50 or fewer employees, there is an exclusion from this coverage. You must qualify for it. I do not have the regulation on it yet because it's not accessible. It will be accessible within the next 48 hours. So I can't tell you with 100% certainty whether your business fits into those exceptions, but there is a limited carve-out for employers that are what we call ultra small, 50 or fewer. As to the issue regarding the students and the being out of school, if the parent is the primary caregiver and does not have alternative daycare or schooling options, that is the only guidance that we have at this point in this bill. Again, unfortunately, this is kind of what, if many of you were around back in 2009 when the Affordable Care Act was passed, we got this 2,000-page bill that you would think would have every I dotted and T's crossed, but then we ended up with an additional 8,000 pages of regulation to clarify it. That is what we will expect to see in this circumstance. At this time, it's any parent with a student where they do not have alternative care for their employee's child. They are allowed to basically take that time off of work, protected under FMLA, Family Medical Leave Act protections, which is a job-protected leave. And under this new bill, it would provide 2/3 of their pay for up to 10 weeks on that issue.
Brian, can you clarify, and I understand there may be some speculation here again on, I guess the question is, what would sort of be the claim related to COVID-19 as it relates to workers' comp and how you might see that playing out?
Sure thing. The claim related from a workers' comp standpoint is I was exposed to a hazardous condition within the course and conduct of my employment. As a result, I became ill. It's the same thing as if there was an unsafe working condition and a worker injured, sustained a slice of his arm or fell off of an unsafe ladder. The workers' compensation provisions cover injuries or illnesses that occur within the workplace as a result of the exposure of the workplace. And truly, I don't think that that's going to be applicable to most employers, but it will be those. I could see it happening in restaurants or food service where employees are interacting with customers on a daily basis and touching and feeling stuff, money exchanges, credit card exchanges, those type of things. Obviously, anything in the medical or healthcare fields, that's where I think we're going to see a majority of any kind of workers' comp claims. But for the most part, they are items that we have to at least be thoughtful of as we're exposing our employees to potential risk.
Great, thank you. And you may have seen my response to a question. We are recording this and sending this out. I'm going to go back just one more time to our medical folks. If Roger and I'm not sure how many members of your team are still there, but clarifying again on the key characteristics people are looking for. Specific question about shortness of breath, as that is still considered a screening symptom, but maybe you could just review those one more time.
Yeah, it's Bud Lawrence. Hi. Before I answer that question, which is a great question, I just want to circle back to the Motrin question that came up before. I had a second to look at that. I wouldn't jump to judgment on that recommendation just yet. I don't know that the evidence is there. The evidence seems weak. Everything evolves. Things may change, but I just want to throw that out there. I wouldn't necessarily wholesale not give Motrin in this situation. So as far as symptoms go, yes, shortness of breath is a symptom. I wouldn't call it a screening symptom, though, because really only about 19% of patients have shortness of breath based on our knowledge of about almost 56,000 patients from the China experience. Much more commonly during the course of their illness, most all patients had a fever. About 90% of patients had a fever. About 68% of patients had a dry cough, and about 33 to 38% had fatigue. Below that, a little over 20% had a wet cough. But shortness of breath is definitely a symptom, but that would be a late presentation symptom and potentially indicative of somebody who may be heading down a pathway of requiring admission to the hospital. But truly about, on average, probably 80% or so of all patients who contract COVID-19 are going to have a very mild course of illness. About 15% may require admission, and then 5% would require intensive care.
Great, thank you. As I indicated at the beginning, and as you saw on the previous slide, if you have further comments and questions or follow-up, please do not hesitate to reach out to me. I believe everybody has received at least one, if not more than one, email from me regarding this. We do have, as I indicated, a resource page on the EDC website at scvedc.org/coronavirus. We will put a link to the replay of this and other information as we gather it. This is obviously a very rapidly changing situation that every time you open the news, you're getting something new of what a different county is doing or city, and I anticipate that pace of new orders and changes is going to continue over the next several days. So we will be updating that with the latest information as best we can. It also has links to other resources, and we're doing our absolute best to tailor that to the most relevant information for companies here in the Santa Clarita Valley. I also wanted to alert you that we are doing a special economic event with our economist, Dr. Mark Schneep of California Economic Forecast. You may know unfortunately, we had to cancel our economic outlook event that we do annually last week due to this situation. So Dr. Schneep is going to bring sort of the latest and what the current projections and current scenarios are for the economy based on this. And then we will be having our regular, if you can call it anything regular at this point, event in September, which will then have an updated forecast. So the link is there. We will certainly also be putting that up on our resource page, but that is a free webinar as well that we are making available to you. So please know that is there. We have just a couple more questions coming in. Dr. Lawrence, thoughts about small groups getting together, private residences. We certainly know that that's an area where people there's been a lot of changing information about that. Please, can you comment?
Yeah, there has been a lot of changing information. I mean, you can hear recommendations from as many as events with 250 people or more being shut down, all the way down to maybe 10 people might be too many. I think that you need to be prudent about your decision-making process. If the reality is, if you stayed home alone, you are very unlikely to get this illness. Once you start bringing people into your house, there's no need to panic about it, but you need to be sensible about it. If you're having a book club or a birthday party, it may be prudent to do your best to informally screen people that you're inviting over. Have you had any fever? Have you had any cough or any signs of illness? And even keep in mind, we are still in the flu season. We're still in a viral season. There are many, many more common things out there besides COVID-19, but I think it's advisable to ask those questions and maybe use those answers to determine your course of action.
And then the big loaded question, which I understand will be speculation on the part of any speaker, but I will toss out there, which is, do we have any awareness that there may be additional orders coming from LA County about shelter in place, similar to what has happened up in the Bay Area across multiple counties?
Is that question for me?
Nobody wants to touch it, I'll touch it.
I'll just speculate, I guess. I think within LA County, I would expect that to occur on a very local basis. If there's a hot spot identified anywhere in LA County, I think they would act on that. The county is spread out quite a ways. We have much different activity that could be going on within the county, but not affecting the whole county.
And I think even if you look at Orange County's recent quasi-lockdown, it seemed to be, on my brief read of it, fairly light. I think the economic impacts of making these decisions are vast and deep, and I think they need to be thought through very carefully.
And I will just let folks know that I am in regular contact with our county officials. I think there will be additional information coming on that. I can't say how extensive those orders might be, but I do think that it is, things are going to continue to change. A couple more questions, Dr. Lawrence, and then I'm also going to pose a question back to the group. First off, what about animals? Are there pets transmitters, carriers of this? Anything people should be doing in their homes?
Yeah, that's such a great question. Whoever asked that, good job. So most coronaviruses actually do live in the non-human animal communities. That's their reservoir. Oftentimes bats. Actually, bats are the most common carriers of coronaviruses. That family of viruses. Yes, you can. I've seen some cases of dogs that have had it. Again, though, these cases are very intermittent. I'm not a veterinarian. I can't give any advice to that, but I wouldn't exclude potentially other mammals getting this virus. The thing you have to understand is it's an RNA virus, and RNA viruses historically don't do the best job replicating. They tend to mutate frequently because of the way that they replicate is sort of inefficient. So really anything's possible in the future, and I think you just have to be cautiously optimistic again that the animal reservoir in our homes, for example, won't be a significant contribution.
Thank you. And then a question asked and a comment back to the group that you can please hopefully respond to me offline. You have on the screen my contact information. Again, I think most of you have received my contact info. And that is about, should we have a follow-up webinar on this, and if so, what questions should we cover in that? And Brian, there's another one that came in for you just before we conclude, which is about work share. Is work share an option, and if so, what parameters should companies be thinking about?
Sure. So work share is still an option. My contact at the EDD, though, was sharing with me that there is an inundation on requests for work share. So be patient with the system. Yes, it is still a possibility. Yes, you should be exploring it, especially if you're looking at just reducing employees' hours. But don't hold your breath to have a whole lot of assistance or guidance through the process as far as the EDD goes in the immediate future.
Okay. With that, what we're going to be doing, as I indicated, we are going to be setting this video up as a replay option for folks who are on our resource page and available to others. So I want to thank everybody for participating. My inclination is that we would like to have another session on this, depending on what happens over the next several days. We can decide whether that is in a week or in 2 weeks, and I certainly would ask for your input on topics you would like covered. I can certainly include folks from LA County or the city of Santa Clarita, continue obviously our experts here in both management, legal, and health. But certainly in the meantime, please consult our resource page. We will keep things updated. If you are not receiving our emails, please let us know. We will make sure that we get that resolved. I want to wish you all the best of luck and best of health as you move forward. And we will be continuing to put Q&A and information up to folks and sending that out to folks individually if we didn't fully get to every question here. So thank you all for your time and participation today. Please let us know what else you are needing and questions you have. We will get them. And I want to wish you a very good afternoon. So thank you all.
Thanks, Holly. Okay, now we're off.